Hello, welcome to the Daily Health Boosters channel. When you think of diabetes symptoms, what comes to mind? I am sure you remember at least 3, too thirsty, too much urine, and weight loss. And you are right. These 3 symptoms of diabetes have been reported since ancient Egypt, 1,500 years before Christ. In this video, we will discuss the top 10 symptoms of diabetes. And the earlier you discover diabetes or prediabetes, the better. Because it's possible to avoid the consequences of diabetes, and if you're pre-diabetic, you can avoid becoming diabetic, and we're going to talk about how that's possible in this video, so watch it all the way through. But first, if this subject is interesting for you, I invite you to subscribe to the channel, like this video, and share it for people who need this information, since diabetes is a very common disease. Let's start by clarifying for you what type 1 diabetes is. Type 1 diabetes is an autoimmune disease, where there is destruction of the beta cells of the islets of Langerhans in the pancreas, by the body itself. The body attacks its own cells, until the pancreas can no longer produce insulin. It can occur at any age, but is more common in children and adolescents, with the peak being between 10 to 14 years of age. Type 2 diabetes, on the other hand, which is the most common type, has insulin resistance as its key point, that is, insensitivity of the tissues to insulin. Unlike type 1 diabetes, the pancreas cells produce insulin, sometimes even more insulin than normal, but the production is inadequate to prevent hyperglycemia. In the past, we saw it only in older adults and the elderly, but today, with widespread obesity, there is a significant increase in children and adolescents. So we can say, obesity is the most important environmental factor for insulin resistance, prediabetes, and type 2 diabetes. But what kind of obesity? Mainly belly obesity, the visceral obesity. Subcutaneous fat has less association with insulin insensitivity. So we see the differences between apple obesity and pear obesity. In apple is that the fat is located especially in the region of the abdomen, arms, and neck. And in pear obesity, the fat is deposited in the lower parts of the body and has a less harmful character. And pay close attention to this. We know that physical exercise changes the location of fat deposition, as we have seen in Japanese sumo wrestlers. They have a diet of 7,000 calories/day, but because they exercise a lot, they hardly have diabetes and triglyceride problems, even though they are morbidly obese. And does genetics influence diabetes? Yes, especially type 2 diabetes has a strong genetic component. Studies with identical twins have shown that if one twin has type 2 diabetes over the age of 40, the other twin has a 70% chance of becoming diabetic within 1 year. Is there a difference between the symptoms of type 1 and type 2 diabetes? In part, like type 1 diabetes, the body can no longer produce insulin. It produces very little or zero insulin, usually the glucose gets much higher, and it is a more severe diabetes. So the symptoms are easy to see. As it is more common in children, that child they start to eat a lot and even then, they lose weight quickly, they wet the bed, even in cases where they had never wet the bed before or had already stopped wetting the bed, and even cannot hold their PP in the classroom, to their embarrassment, in front of their peers. The child becomes more irritable, she starts to fight, to yell at others. Even though the child used to be quiet. He becomes very thirsty, complains of blurred vision. And one important thing, type 1 diabetes can cause diabetic ketoacidosis, which is very dangerous, and can lead to death. Ketoacidosis is an acute complication, typical of the type 1 diabetes patient, and it is associated with stressful conditions, which lead to an increase in counterregulatory hormones, as in an infection, or around a school test. And the symptoms of ketoacidosis are different, so pay attention. Sometimes severe abdominal pain, nausea and vomiting, can't even eat, exaggerated weakness, shortness of breath and rapid breathing, mental confusion, and the breath smells like rotten apples or other spoiled fruit. If you have any symptoms, you have to rush to the doctor, where besides high blood sugar levels, you also have high levels of ketones in your urine, so ketoacidosis. If your case is not type diabetes, and you wonder, what are the signs and symptoms that I should look out for if I think I might have type 2 diabetes? Sign or symptom 1, dark patches on the skin that form in the folds of the neck, armpits, or groin that may be smooth and velvety. The person sees that the neck is dark, sprays it with loofah, ointment, and it doesn't get better. It is not dirt. It is called acanthosis nigricans. And it is due to the excess insulin that your body is producing, which causes normal skin cells to reproduce rapidly. For those with dark skin, these new cells have more melanin. And it is exactly this increase in melanin that produces skin blemishes. So take a look at your neck. Acanthosis nigricans is a strong predictor of diabetes in the future. Symptom 2. Periodontitis. Periodontitis is a common chronic inflammatory disease characterized by the destruction of the supporting structures of the teeth and is characterized by swelling and redness of the gums, bleeding gums, gum recession, soft teeth, and tooth loss. It has multiple negative impacts on quality of life. And diabetes is a major risk factor for periodontitis. It is about 3 times more frequent in people with diabetes. And get this, the risk of cardiorenal mortality is 3 times higher in diabetics with severe periodontitis than in diabetics without severe periodontitis. So if you are diabetic or pre-diabetic, take good care of your teeth and gums, because in the body, everything is interconnected. Symptom number 3, itching and fungal infections. Excess sugar in the blood and urine provides food for the fungi, which can cause infections. Fungal infections tend to occur in warm, moist areas, such as the mouth, genitals, armpits, and groin. The affected areas usually itch, but the person may also feel burning, redness, and pain. Fungi feed on sugar. Keeping blood sugar levels in the normal range can help reduce the risk of infection. Some types of candidiasis can lead to serious complications if left untreated. And a detail: if you have repeat urinary tract infection, you need to see if you are not having diabetes, as diabetes also increases the risk of bacterial infection. Symptom number 4, visual blurriness. Visual blurring can happen in the diabetic. That person who used to be able to see well and now is seeing blurry, blurred vision can be a symptom of diabetes. But why? When a person has high blood sugar levels, the sugar inside the eye also increases, and causes water to be drawn into the eye, causing the lens of the eye to swell and change shape. When the shape changes, the result is blurred vision and lack of focus. And diabetes can also cause darkening of vision if blood sugar levels drop too low, in hypoglycemia. But of course, thinking about vision, diabetes is the leading cause of blindness in adults in the world, due to diabetic retinopathy. Long-term uncontrolled diabetes damages the small blood vessels in the back of the eye, the retina. And this can cause blurred vision. Symptom number 5, burning in the feet. Diabetes and prediabetes are the number 1 cause of burning feet. But why? Because of diabetic neuropathy. And we know that diabetic neuropathy can affect up to half of the people with diabetes, and if it's damaging peripheral nerves, it's damaging other organs, your eyes, your kidneys. Some diabetics have mild symptoms. But for others, diabetic neuropathy can be very painful and disabling. Symptom number 6, fatigue. According to the ADA, American Diabetes Association, 61% of people newly diagnosed with type 2 diabetes experience fatigue as a symptom. It is simply the second most common symptom. Why? Because the cells in your body may not be getting enough glucose and run out of energy. But also this exaggerated fatigue can be because of the diabetes diagnosis, which causes anxiety, because you are waking up a lot at night to urinate, because you are overweight, which causes fatigue, and even sleep apnea and snoring. Some diabetes drugs, such as metformin, can lead to B12 deficiency, which is associated with fatigue. Symptom number 7, exaggerated hunger. And the detail, diabetic hyperphagia is not the same thing as binge eating. With binge eating, the person eats an excessive amount of food, even though he or she is not hungry, usually due to an emotional component. In diabetic hyperphagia, the person feels hungry constantly, whether they eat or not. And why do they want to eat precisely sweets? Because the body's cells are not getting the sugar they need. Symptom number 8, excessive thirst. Diabetes causes excessive thirst. When your body can't process sugar properly, your kidneys will start excreting sugar, and the sugar will pull water with it. It will dehydrate you, it will cause osmotic diuresis. Your kidneys will produce more urine, which triggers a thirst response that causes you to drink more water. And this thirst is usually also accompanied by dryness of the mouth prolonged. Symptom number 9, unexplained weight loss. This symptom is most common in type I diabetes, where insufficient insulin prevents the body's cells from getting glucose from the blood to use as energy. When this occurs, the body starts burning fat and muscle for energy, causing unexplained weight loss. Now, if you are having glucosuria, which is peeing sugar, you may also lose weight because of this. The new diabetes drugs can also lead to weight loss for this reason. Symptom number 10, frequent urination. One of the first symptoms of diabetes is the need to pee more frequently during the day. You will get thirstier, you will drink more fluids, and you will get up more at night to urinate. When there is too much sugar in the blood, which happens if you have diabetes, your kidneys have to work harder to get rid of it. This forces them to produce more urine. And the glucosuria, the loss of glucose through urine, makes you dehydrated, and you will take in more fluid, which will increase this vicious cycle. But also diabetes can increase the chance of a urinary tract infection, which can lead to urinary pollution. So you see that the symptoms are all interconnected. But, if you have the symptoms of diabetes, what should you do? How do you make sure you have diabetes? By getting a blood test. Normal fasting blood glucose is up to 99 mg per dl. If you are between 100-125, you are in the pre-diabetic range. If you have 126 mg per dl onwards, you are diabetic. But it's not just fasting blood glucose. There is the oral glucose tolerance test. You have to drink that sweet liquid. If it is normal, it is up to 140 mg per dl in 2 hours. If it is between 140 to 199 after 2 hours, you are pre-diabetic, or from 200 on you are diabetic. And the glycated HB, which is the average of the last 10 weeks of your blood glucose, normal is below 5.7. Between 5.7% and 6.4% is pre-diabetic, and above 6.5 is diabetic. Of course, one test alone does not confirm whether you are diabetic or pre-diabetic. You have to repeat the test to be sure. You have found out that you are pre-diabetic and are hitting the diabetes barrier. Now what? How to prevent a pre-diabetic from becoming diabetic? This question was answered through the DPP, Diabetes Prevention Program, study where they evaluated over 3,000 people with pre-diabetes and allocated them into one of 3 groups. Lifestyle change, they had to lose 7% of their weight, eat fewer calories, and exercise 150 minutes per week. In the other group, they used metformin 850 mg 2x a day. In the third group, they gave placebo, flour pill, which was the control group. The lifestyle change group was the winner. It reduced the risk of becoming diabetic by 58%, and the metformin group reduced the risk of becoming diabetic by 31% compared to the placebo group, over 2.8 years. So yes, it is possible to avoid diabetes, and in some cases even get out of diabetes, with weight loss and lifestyle changes. Did you like the video? Remember to share it so that more people have access to this knowledge. We hope we have helped you. We wish you good health. See you soon.